we've made significant achievements and impact over the last 5 years. We have grown the number of patient and public contributors within our 3 PPI groups. We now have greater diversity in ethnicity, gender and age that represents the demographics of our condition-specific themes and our regional population. Our patient-led liver and gastrointestinal PPI group has increased in membership from 5 people to 23. The group initially comprised of predominantly British white males over the age of 65. However, today a quarter of our membership identifies being from one of 5 minority ethnic groups, and almost 70% of the group are female, with the same percentage of members being under 65 and currently in unemployment. Our public contributors have been involved in more than 60 projects, large and small, from local to regional and international work. The type of involvement ranges from research prioritisation and gender setting, supporting grant applications and helping to design trials and trial devices, to co-presenting at conferences, shaping patient information sheets and being part of steering committees. They've also co-created strategies to increase membership of public contributors. They have been involved in creating PPI training materials and have helped to deliver more than 20 workshops to over 180 people, a third of whom were from the general public. Members of the Muscle Health PPI group were also integral to the development of the massive open online course about healthy ageing. The group have also been piloting the Student Patient Alliance developed by the Rheumatology Research Patient Partnership PPI group, whereby PhD students and patients are matched up to support reciprocal learning. We are proud of the work our public contributors undertook to support Public Health England to deliver effective COVID testing materials at the start of the pandemic. By working with the Applied Research Collaboration, or ARC, West Midlands, another bit of the NHR infrastructure, we were able to provide public involvement at pace, and we shared our learning as a case study afterwards. The impact of involving our public contributors has now resulted in the annual co-delivery of a PPI section with the ARC West Midlands for their researchers as part of one of their research modules. Hosting community and charity related events is an integral part of our PPIE strategy. In collaboration with Crohn's and Colitis West Midlands, we hosted a face-to-face irritable bowel disease No More event to share their research in this area with patients, the public and the scientific community, and to encourage accessibility. Our next planned event will be hosted virtually. At the request of patients, a freely available and interactive webinar series about advanced therapy treatments was delivered with the Midlands and Wales Advanced Therapy Treatment Centre. The session recordings, which are still regularly accessed online, continue to have an impact on patients. A Research Changes Live showcase at the Birmingham Library highlighted research from across the Midlands and NHR infrastructure, including the James Lind Alliance, a local cancer survivors choir. This was a truly accessible West Midlands event, receiving local BBC coverage, which delivered mutual benefits to patients and the public by increasing awareness and supporting the recruitment of valued contributors. We continue to expand our engagement by using a variety of communication channels, such as hospital and community radio, and have jointly established a Midlands-wide PPIE conference in collaboration with other NHR infrastructure in the region. We know there is more to do. Because of the diversity our region offers, we are well placed to be a pilot site for the NHR's Race Equality Framework to assess how our current policies, practices and organisational culture could be changed to better serve diverse communities, foster improved race relations and ultimately improve healthcare delivery. We'll be using this as a springboard to develop even more creative and novel ways of engaging and involving our patients in research to ensure that we are part of the drive to eradicate health inequalities and improve the health of the nation.
Thanks very much for agreeing to talk about your role with the Birmingham biomedical resource centres, public involvement groups. And you're been one of our patient contributors for a few years now. And I thought it'd be brilliant to talk to you about what group you're in and find out about the impact that you think it's having. So can I just remind me, which group are you in?
Oh, well, I'm in the liver and the GI public and participation involvement group with the Birmingham Biomedical Research Centre. Well, I must admit, I mean, I really love taking part in the, BRC's liver and GI group. I think it's really active, very well attended. And then when this came up, it was a presentation actually that was given, I think by yourself.
It was actually, yeah.
About a government initiative by the National Institute of Health Research, I believe it's called, isn't it? Yeah. And they are running a pilot project in relation to having designed a race equality assessment framework. And then, of course, Birmingham has been chosen as one of the pilots. And as soon as I kind of saw that presentation, I thought, fantastic, this is something that I do believe that I can get involved with and actually, contribute to, excuse me, in a positive way. So it's been fabulous. I mean, we're kind of in the middle of it, and I have been involved throughout, and it's been wonderful. That really shows that the BRC is really serious about having representation and reflection on the group and in its organisation from all sectors of the community, and so that makes me feel, even more sort of enthused, really, because I feel that I'm being listened to, I'm being heard, as a member of the, a minority in terms of in the UK, group. And I feel that, and it's been demonstrated to me personally that my opinions and my suggestions have really been taken on board. Not by you, Laura, not just by you, I should say, because, I kind of expect that because you're there, it's supporting us all the time, but, by the managers and other people involved in the BRC and its partners, and by top level, because that's what I'm interested in kind of influencing and seeing change happen for the better and for, for positive purposes, and all for, a better experience for patients. That's what we're here for, is actually to see improvements being made in research and improvements being made in service delivery. And I do feel that things that I've suggested, my opinions, have been taken on board positively and have been actually, used. So, for instance, when I was asked to take part in the event, a national event where we were sharing and learning from others and actually kind of relaying what we are doing here, that was a really kind of validating experience for me. I did feel, I mean, it was a senior manager that asked me to do that through the BRC, and I thought that means that they're actually really listening and really sort of heard what I've got to say and valued it, and then asked me to, present that directly.
I am known for being quite extroverted and assertive and outspoken in terms of making sure diversity is part and parcel of what we're trying to do in terms of inclusion, in terms of equity, equality, diversion, inclusion. We do need to be part and parcel of the solution and be there around the table when decisions are being made. So I grabbed the invitation with both hands. It's a very interesting impact to be able to have and share with people. And I think it's been a two-way process where the scientists have also learned from us, and vice versa. A meeting of the minds. We sometimes beg to differ on things and our approaches, but there's nothing wrong with sort of compromising and saying, well, this is how it is from a cultural perspective, cultural competence point of view in this Muslim community or this Asian community or this Hindu community. But we need to do that and do that more often. And I would encourage other people to put themselves forward.
Chair of the Liver and GI Patient and Public Information Panel, and it was formed to provide both public and patient involvement in research into liver disease, especially chronic conditions like cirrhosis and non-alcohol related fatty liver disease. Following the NIH funding of the Birmingham Biomedical Research Centre in 2017, the group's remit expanded to include gastrointestinal disorders, including inflammatory bowel disease such as Crohn's disease and ulcerative colitis. And these conditions may affect a wide range of the population, from children to elderly people, and range right across ethnic groups, which is particularly relevant because of Birmingham being a very diverse population.
And what are the main areas that people are researching that you work with?
One of the areas to do with liver transplants is that it's very difficult to time liver transplants, because historically the liver has to be transplanted within a very short space of time after being removed from the donor. One of the trials has been to do with what's called normothermic perfusion, which means actually keeping a liver alive outside the host of the donor's body by passing blood through it and looking after it at room temperature. And that means it can be kept alive for up to 48 hours. And that was a really groundbreaking piece of research that the panel was very involved in providing feedback to the researchers on how useful they thought that would be. Most of the members have either direct or indirect experience of either liver disease or inflammatory bowel disease. But some members, such as myself, are involved because of a general interest in research. We decide our own agenda, and we decide who we want to come and talk to us and present their research. And many times researchers will come along and they'll present ideas or thoughts we can contribute to. We can say what we think of them, whether we think they're a good idea, whether we think that maybe they need a bit more work, or maybe indeed we can offer alternative direction. And all of that is a very interesting, powerful way of contributing towards research.
Thank you, that's massive. And I think what I'm interested in as well is, well, what impact do you think that's had?
I think the panel has had significant impact on the conduct of research in the areas of interest. The panel as a whole and individual members have contributed in a variety of ways, including one of the things that we do is to look at patient-facing written material like patient information sheets and improve the readability and accessibility. So we're able to improve those. We help to direct the conduct and direction of research, and we do that in a number of ways, acting as co-applicants for grants, co-researchers, so actually working with the trial researchers themselves to help to direct the research, taking part in the technical committees which oversee the research and make sure that it is being done in a proper and useful way. Improving the reporting of trial results by supporting changes in practice, something that I particularly am interested in making sure that when trials have been completed, that the results are made available to the general public. Liaising with researchers to help them make the best use of non-clinical experiences, and contributing and co-delivering PPI training for the public and to research staff with BRC's Public Involvement and Engagement Manager, in other words, you, Laura.
And what kind of things do you get involved with?
Well, we get involved in the funding of trials and the studies. The researchers call upon us from time to time to listen to what they're planning to do with their research. We're representing the patient and the general public, and making sure that what the researchers are doing is relevant to our lives. On occasion, that has led them to redesign their studies, which we found to be, making our contributions worthwhile. We realised that the researchers want to involve us, and it's been important, and it's changed the way that the group think about research. And likewise, we found that with the researchers, that they think differently about the way they carry out their research, which I suppose is the prime reason for having a group like ours.
Elspeth, I was wondering, can I ask you to tell me a few words about why you're on the executive board and what group that you represent?
I represent rheumatoid arthritis on the board. I think one of the fortunate things about suffering from rheumatoid arthritis, I'm not sure there's more than one, is my involvement with this group, where I've come across a group of really interested, dedicated people, and ones who are very keen on having patients as partners working alongside them. And there's a really good team of other people who are involved with us as well, which perhaps that big team of people is something that is a real strength of our group, which is called R2P2. We do a variety of things, just like you've heard Ian and Bob say, but we have visited the research labs as a group. We have a number of talks through the year about things. We have seen machinery that is used in investigations working. We also, again, support bids for funding. We're involved in the writing of papers, the editing of papers, and information as well. So it's really quite an active group. And in the old days, pre-pandemic, there would probably be about 20 of us turn up to a meeting, which was very sociable as well. One of the things that I think is good is that the researchers from the BRC are also involved in something else called RACE, which is a 4-university consortium. And through that, we've started being paired up with PhD research students. And the idea is that they tell us about their research and learn to explain the very complex things they're doing in simple terminology for a lay member. But we also can talk to them about how the disease actually is and how it affects our lives.
That's really important, isn't it, to hear from the user, if you like?
Yes, I think the impact on getting them to really understand perhaps a whole person, to realise this isn't a disease about a cell or of a cell, it's a disease about a whole human being and their life.
I'm actually the lead member of the public involvement group for muscle health, which is, to use the medical term, about sarcopenia, which is muscle wasting, basically. I joined basically in 2018 because the BRC, Birmingham BRC, was just getting underway, and we needed to have representation for sarcopenia because it's a major part of the interlocking research that the BRC do. And so the group was basically founded early in 2018, and with your assistance, Laura, we got it going fairly quickly and started taking in additional members.
What do you think is the impact of having public involvement in these projects, Bob?
Well, from experience, the researchers usually start out at an early stage in their research project, maybe at the funding stage, and they invite us along, and we have a big discussion. These days they're on Zoom, of course, and they tell us the brief, the outline of what they're hoping to do research into, And we have a think about it and we discuss it amongst ourselves. And quite often we've said things to the researchers that they just hadn't crossed their minds about. And in that way, we've sort of, I suppose, modified their research projects. Certainly, sometimes they don't think of the practicalities too much. Can you think of a different way of doing it? And by doing that, we make them think long and hard about the involvement of the people taking part in the research, which I think is the valuable thing that we contribute towards their research.
One of the things that I think has been very evident over the last few years is the way that the three groups can actually work together. And we're all essentially looking at the same kinds of conditions, but from different viewpoints. So it's all to do with inflammation. But the way we've addressed it can be quite different. And I think we have got a lot to learn from each other.
Every person on the planet at some point is affected by health issues and has interface with some sort of health, service or professional or whatever. So it's just it affects us all, and that's why I think this work and being involved in this work for me is a really important thing to do.